So what's on my mind today? Well, I can say that over the last few weeks, what's on my mind every day has been Washington. We had a change in administration in January, and with that came a lot of changes in the world of healthcare and biomedical research. Here at Weill Cornell, we're thinking about this daily. We're thinking about how proposed changes in NIH funding might affect the research work we do. We're looking at how changes proposed in the Department of Education might affect the way that we think about the educational opportunities here at Weill Cornell. Still to come, but certainly on our mind with a new administrator of CMS is how that might affect the way that we practice medicine with regard to changes in Medicaid and Medicare. All of those things are on my mind. But as per usual, in the way that my brain works is that I don't foster sort of negativity in the way that I think about problems. I really try to think, what's the opportunity in the changes that have been proposed? What are the things that we at Weill Cornell might think about in a forward-facing way to really get better at what we do? So, yes, I get concerned about things like cuts in research funding, but then I start thinking, what's the opportunity here? How might we be better at what we do? And if I think about what's on my mind, yes, change is on my mind, but trying to approach change with positivity and seeing opportunities is also on my mind, because that's where we're going. We're going forward, not back. One of my favorite topics, explain F&A, facilities and administration costs, also known as indirects. You know, when we put in a government grant, in fact, when we put in any kind of grant or contract to do sponsored research, we have the direct costs. Who are the people that are actually doing the research, and how do we pay for that? What are the materials that we're paying for? What are the personnel we're paying for? And that's the direct lines in the budget. But then there are a number of things that support that research: the rent on buildings, the air conditioning, the heating, people who are dealing with animal safety, for example. A lot of things have to come together to support a research infrastructure, which are not directs in the sense that they're in the direct line items for that research project. What is actually called the F&A or the indirects is something that's negotiated every several years with the federal government. The federal government says you can put these into that bucket. Those things get audited. Those things get reported back to the government. And so one of the misconceptions I'd really like to address is that indirects are a source of discretionary monies for the dean. They are not. They are used to support the infrastructure of doing research, and it's done in a very method-driven way. So indirects, critically important to provide research infrastructure. The directs, obviously, I think you all know what those are, to allow us to actually do the research, that particular set of research projects. One of the questions I'm often asked is, how do you convince people who are maybe skeptical about your position to maybe see the value in your position? I think there's a couple things to keep in mind here. One of which is to try to understand the perspective from where the skeptic is coming. Why is it that they're viewing your commentary, your reporting with skepticism? What's been their experiences? Listen. Try to understand their experiences. And then for myself, I always think that you should come from a position of data and facts, that you should try to utilize the data that's best been produced, that supports your perspective, and be able to deliver that, not just in a data-heavy way, but using what I'll call narrative, using some stories, trying to weave together stories and data in a way that creates a compelling narrative. Can you always win over the skeptic? No, but hopefully on both sides, you can be willing to try to address what you each think. I think the more you do that with honesty, with sincerity, with data, you can maybe make some progress to bringing somebody over to your perspective. So when I think about why clinical medicine in a medical school, I go back to the tripartite mission of academic medicine. Here at Weill Cornell, we call that to care, to discover, and to teach. Each of our mission is critically important to what we're trying to do at Weill Cornell Medicine. But we are a medical school. We're training people to be clinicians. Yes, we're training them to be scientists and researchers, but we're really training them to think about the care of their fellow human beings. Human health and the care of people with diseases is really front and center in a medical school across our missions. We're excited about curiosity-driven research and where that might lead us. But in a medical school, the emphasis in that curiosity-driven research is ultimately to try to solve problems relevant to human health, to human disease. And so the clinical mission for us in a medical school is always front and center. One of the great things about being at Weill Cornell is seeing the quality and the passion and the commitment of our clinicians, our physicians, our nurses, our PAs, our NPs, other clinical professionals who are serving our patients. But part of the challenge of being at a great place like Weill Cornell is that sometimes it can be difficult to get an appointment with some of our specialists, with some of our primary care clinicians. And so our expansion is critical, really critical, as we begin to think about how do we serve our patient population here in Manhattan, in Brooklyn, in Queens. How do we do that better? And part of the way we do that better is expanding our facilities. Our expansion into 575 Lexington, where we'll be able to do everything from urgent care to women's health to cardiology and neurology and psychiatry, dermatology. This is all going to be a critical part of expanding our clinical mission in the years ahead. Growing our clinical mission allows us to serve our community better. Oh, wow. What is the coolest or weirdest experiences I've had since living in New York City the last, 17, 18 months? I've had a lot of great experiences with regard to food. Special shout out to all of you who have sent me pizza recommendations. Those have proven to be really worthwhile to follow up on. But maybe I'll mention two things. One is I've gotten to go to the opening night of Carnegie Hall twice since arrival here. That has been just an amazing experience to see that on its opening night is something I won't ever forget. But maybe the most fun experience that was, to me, really drove home a message of New York as the city that never sleeps is earlier this year, my wife and I were at reunion weekend, and we went to 10 or 12 reunion dinners. No, we didn't eat at all of them. And by the time we finished going to 10 or 12 reunion dinners, it's now 9:30, 10 at night, and we wanted to eat. Well, in many cities, it would have been too late, but not in New York. With the help of the development team, we walked around the corner, had a reservation at a great Asian fusion restaurant, line out the door. We get to our table, place is packed. There's a high energy. We had a great meal. And when we left at almost midnight, guess what? There was still a line around the door. I don't know that that happens anywhere else. It certainly didn't happen in the other places that I've lived. So kudos to New York for being the city that never sleeps.